Good morning, all of you. Today, I'm going to present our study, Validation of Tamil Version of Copenhagen Burnout Inventory. The burnout is a psychological syndrome arising in response to chronic occupational stresses. It is defined as a triad of emotional exhaustion, depersonalization, and low personal achievements. It has negative implications for the physical and mental health of physicians, career satisfaction, and patient care. Since the beginning of the COVID-19 pandemic, healthcare workers have been under heavy workload conditions worldwide. So several psychometric tools have been developed to assess the burnout, such as the Maslach burnout inventory, which cannot be used free of charge, and the Copenhagen burnout inventory. The Copenhagen burnout inventory is a freely available scale that can be used in assessing burnout in diverse occupational categories. It has been previously translated into Sinhala and used in a group of public health midwives. A validated Tamil translation of the CBIs was hitherto unavailable. Before this study, there was no Tamil translation for CBI validated. Therefore, we were unable to do any research on burnout among Tamil population in Sri Lanka. The Copenhagen burnout inventory is a 19-item survey with positively and negatively framed items. It has 3 areas: the personal burnout, work-related burnout, and client-related burnout. As for the objectives, we took to translate CBI into Tamil and to assess the psychometric properties, including the factor structure, convergent validity, and internal consistency. As for the methods, the CBI was translated into Tamil using standard procedures, and the forward and backward translations were carried out by independent bilingual experts. As for the forward translation, one of them was expert who is aware of the concept of burnout, a consultant psychiatrist. The other bilingual expert was a layperson who was not very familiar with burnout. So we got both translations, then we made a consensus, combined the 2 into 1, then we got 2 other people to back translate it into English, and they are not much experts in the fields. Okay. The translated version was administered to 110 Tamil-speaking healthcare workers in Sri Lanka. The confirmatory factor analysis was used to test the non-3-factor structure of CBI. Depression, anxiety, and stress scale, the JAS-21, was concurrently administered to assess convergent validity. Why we selected the depression, anxiety, and stress scale was that we know that burnout is a separate entity, but it is closely related to other mental health problems. As an example, the people with higher burnout are likely to be depressed, likely to be anxious and stressed. We wanted to check whether the burnout coverages, that's why we did the convergent validity to check the burnout converges with others. As for the sample characteristics of our study, you can see now, according to the gender distribution, the majority of the sample were females. It's about 64%. And as the age distribution, the age group between 21 to 30, that means 20s, took the majority. It's nearly 47%. According to the occupation distribution, there were medical officers, nursing officers, supporting staff, and pharmacists. The majority were medical officers. It's 51%. These are the results of confirmatory factor analysis. So, out of the 19 items of CBI, 1 item from the work-related burnout was removed as its factor loading was poor. It was less than 0.4. That means it was not correctly assessing work-related burnout. Therefore, we had to remove it. Following that, when we consider the model fit indices, they are excellent indicators. The comparative fit index and Tucker-Lewis index are more than 0.95. Other parameters are also in an acceptable range. So the model was accepted. When we go to the convergent validity, the correlation with the 3 has a moderate correlations, which means the correlation coefficient is around 0.4 to 0.5. The inter-subscale correlations were moderate in strength. You can see here, it's between the personal burnout and work-related burnout, it's 0.73. Between personal burnout and client-related burnout, it's 0.45. And between the work-related burnout and client-related burnout, it's 0.58. When we consider the relationship with mental health problems, you can see here, the total CBI score correlates positively with depression, anxiety, and stress. The correlation coefficient is between 0.46 to 0.5. All 3 subscales are showed moderate correlations with just 21. Internal consistency, the overall internal consistency of CBI is Cronbach alpha 0.923. The 3 subscale demonstrated good internal consistency between 0.83 to 0.88. I mentioned earlier that we removed one item because of the poor factor loading. After that, when we consider the 18 items, removal of none of the items led to significant improvement of internal consistency. As for the conclusions, the Tamil version of CBI with a 1 item removed showed excellent construct validity, conversion validity, and internal consistency. These are our references.